everyone, and welcome to Let's Just Do This. I'm Margaret Wallis-Duffy. The co-host is right beside me, Mr. Todd Miller.
Hello, everyone.
How's everybody doing today?
Fantastic.
Good, good. And we're always thrilled to be here in studio, sitting across from amazing guests who are here to educate, empower, and inspire us to live well. And today is no exception. We actually have seen this wonderful professional on our show before, and she's kind of near and dear to my heart as she is one of our Wallis for Wellness team members. Dr. Hillary Webster, welcome.
Thanks, Margaret. It's always great to be back.
Now, you know what? It's really important to understand the background with Dr. Webster because, you know what, it's pretty impressive. And she loves to call herself a science geek, which is why we love you. Really looking at the science behind naturopathic medicine, which is really, really important. You know we're on this Better Together mission of bringing conventional and complementary medicine together. And you believe in that wholeheartedly. So I'm going to read her bio before we start this discussion today, which all of you are going to be really interested in. Everything about thyroid. And I think this is a topic that many people wonder about, many people suffer with, but we're going to get down and dirty today with all the details about thyroid. So Dr. Hillary Webster is a naturopathic doctor who rescues patients from burnout by uncovering root hormonal imbalances resulting from stress. Dr. Webster teaches her patients how to take their health back into their hands and create the energy needed to rule their work and their lives. After having her own health struggles as a patient with no diagnosable illness and left to believe her symptoms were all in her head, I can relate, Dr. Hillary turned her frustrating experience into a mission to provide better answers and solutions to her patients. So that's why we're thrilled to have you back on the show.
Yeah, it's my mission to educate people. I've been calling myself a hormone advocate because there are so many things to know about hormones. Thyroid is just one of them. When we think of hormones, we tend to think of sex hormones, but we have hormones saying all sorts of different things. All hormones are chemical messengers. So your thyroid is one of them. Your sex hormones, obviously your estrogen, progesterone, testosterone. Insulin is another hormone that controls blood sugar, and that's really important too. And then you also have your stress hormones, so your cortisol and your DHEA, and so on and so forth. You have hunger and fullness hormones. All of these hormones are talking to each other, and I like to teach people how they work and really uncover what's going wrong.
And that empowerment is so critical. But I know, Todd, and this is why I always love having you shoulder to shoulder with me, you love to ask some of the questions that so many people are wondering. So let's just start with a very simple first question.
Let's get to its core. Basically, I want to know, and I'm sure there are lots of you out there that don't know, what is the thyroid and what does it do?
That's such a great place to start. Let's start at the beginning with the basics.
Yep.
Thyroid is a gland. Hormones come from glands typically. So hormone is this the thyroid, is this butterfly-shaped gland, and it produces thyroid hormones. Thyroid hormones talk to all your cells in your body and tell them to go, basically. It is the master regulator of your metabolism. So people think they have sluggish metabolism. They think, they feel tired, they're putting on weight, they can't go to the washroom, they have trouble eliminating, they have dry skin, their hair's falling out. They think thyroid. So you think about thyroid symptoms without actually knowing what it does. So I'm so glad you asked because that's a perfect place to start.
So let's dive into this thyroid question and why, this discussion and why you're so passionate when we think about the thyroid. Where's the best place to start when we're talking about thyroid?
A good full panel of tests. So I had a lot of thyroid symptoms. My periods were going off when I was getting sick. So they were becoming less and less frequent. All my hair was falling out. I was exhausted. My mood changed. Everything was going wrong. And everything pointed to thyroid. And I kind of had to ask and plead with my family doctor, who I have a great relationship with, to please, can you test the full panel? Most of the time, what the regulation is to test TSH. That is thyroid stimulating hormone, and that comes from your brain. That is a signal that comes from your brain that tells your thyroid, all right, we have to start secreting thyroid hormone. So when TSH is high, That means that's your brain's efforts to try to kick your thyroid into gear. So TSH is high, your thyroid function is low. So when TSH is high, and we have different ranges of what is normal, I look at a very different range than, say, the medical profession may. When that TSH is high, there's something going wrong along the chain. Now, unfortunately, TSH can look normal, but there are other thyroid hormones at play. We have to test your T4, we have to test your T3, and we have to test your antibodies. And that's a whole thing that we'll have to get into as well, because those are the hormones, at least T4 and T3, that are telling your cells what to do. So we have to start with a panel, and you have to have somebody who's well-versed in thyroid, like me, to look at it and say, is it actually functioning optimally? Because it may be functioning fine, within normal range, but we always have to remember, with normal ranges, it's an average. It doesn't indicate optimal function.
Oh, and
wow.
I love hearing you say that, because how many times do we see in our clinic and hear from patients, I was told that everything is fine, but they don't feel fine.
Yep.
That also adds to anxiety, because now, well, then what's wrong with me? It's like you said, it's all in my head, which impacts their hormones. I think it really behooves us to say that Dr. Webster has additional education in hormonal health. Can you speak to that a little bit, so that our listeners and viewers understand that you've taken additional training when it comes to hormones, over and above perhaps even what some of your counterparts in naturopathic medicine have?
Right, so I'm always looking to add to my toolkit. I already have a pretty big toolkit to begin with, but I just took even a new thyroid seminar a few weeks ago that was put on by medical doctors and some of my contemporaries who are very experienced in thyroid health, to continue to reinforce the training that I've had. I'm always doing continuing education on hormonal health. I've certainly worked with other professionals, whether it's medical doctors or pharmacists, to see what their take is on thyroid. And as I know, it's Margaret's mission to always link arms with everybody, and I'm definitely, on that boat. We want to work together to be able to provide the best care for somebody. So I'm always reaching out to people to see what their strengths are and to work together. But yes, it's something that I've been very passionate about. I do a ton of reading on thyroid, and I do a ton of extra training on hormones. I'm very, very passionate about stress hormones, sex hormones, and thyroid, because people need more answers.
Absolutely. You can't feel her passion at all.
No, not at all.
I love
Not
this.
at all.
I do love it, Hillary, because and behind that passion comes a true concern for the patient, and not just the patient as a person, but for their optimal health.
Yep.
Not just dragging themselves through at this basic level. And that's where I think, bringing conventional and complementary medicine together really helps to elevate the game in terms of our optimal health.
Yep, 100%.
It's funny, you were talking about, you were both talking about how things are testing within normal ranges. So theoretically, you should be fine. And some people would say, well, oh my goodness, you have a stressful job, you have children, you have aging parents, that's all it is. But with someone like you who has additional training, you're digging deeper. You're saying, no, that's not, there's something medically that we need to find.
And here's where I get really nerdy. Thank you, Todd, for bringing this up, because I'm a huge nerd for stress physiology. So how does stress actually chemically affect your body? Stress hormones slow down your thyroid at both the level of your thyroid and the level of your brain. So those hormones, your stress hormones, actually go back and inhibit, so prevent your thyroid from functioning properly. So I see this all the time in my office. I will tell my patients, let's see a full thyroid panel. And we look at it and we see, okay, TSH is normal, that's fine. T4 might be within normal range, but that's the inactive version of the thyroid hormone. Your thyroid hormone then needs to be activated to T3 in order for the cells to even recognize it. So it's that T3 that there's actually a lot of trouble converting. And so there's a lot of vitamins and minerals that are responsible for that conversion, and those vitamins and minerals are often used up by stress.
And so what I love about this discussion, so we're understanding the why things happen.
Yeah.
But we're also here to talk about, so how do we help that? So when we're talking about minerals and vitamins and what have you, so if I'm sitting across from you, Dr. Webster, as a patient, what are some of the things when it comes to, we've uncovered that now,
Yeah.
now what?
Yeah, so some great question. Of course, what do we do with this knowledge? So being kind to your thyroid, diet is always a huge part of it. Lifestyle is also really important. So are you de-stressing? What is it that you do that you like in your day? Are you doing any sort of meditation? Are you getting out in nature? Which, yeah, there's science behind it, but I think we intuitively and instinctively know that it's good for us. Green spaces do decrease your cortisol levels, which is fantastic. But there are some medical doctors out there who practice in a thyroid specialty kind of way, who are looking at testing some of your vitamins. So they'll test vitamin A, they'll test vitamin D, they'll test iron. Make sure you don't have iron deficiency anemia. If you have an iron deficiency, your thyroid hormone isn't going to convert properly. Iron's really important for that. Some of the testing is accurate and some of it isn't, but it's good to know. Either way, you need to eat as colorfully as possible to get those really important antioxidant nutrients into your body to help your thyroid. So vitamins that are really important for thyroid are A and D, and some minerals are zinc and selenium and iron and magnesium. And a lot of those, like I said, are used up by stress.
Right. Okay, so much to take in. We need to digest that literally and figuratively for a few minutes. So we're going to take a break and we'll be right back. So stay tuned. We've got more with Dr. Hilary Webster coming your way. We'll be right back.
Welcome back to Let's Just Do This. I'm Todd Miller along with Margaret Wallis-Duffy and our naturopathic doctor, Dr. Hilary Webster. Wonderful chat about thyroid. And we may have touched on it, but there's hyper and hypothyroid. So I want to touch on that. And for me as a patient, if my thyroid was going either one of those ways, what would I be feeling? What would be the symptoms of those two conditions?
Right. So what does that look like?
Yeah.
So hypothyroid is a sluggish thyroid. The thyroid is working slower than normal. So what that looks like is a really stubborn weight gain that you can't seem to take off the weight despite good diet and exercise and all of that. I have plenty of women coming into my office saying, "Oh my gosh, please tell me it's a thyroid issue because I'm having trouble." And I get that. So it can often look like that. Often there's constipation. Sorry, I talk about poop in my practice all the time.
Absolutely.
We've seen it.
Keep it real.
Yeah. So constipation's a huge issue, and sometimes it's nutrient deficiencies, and sometimes it's actually thyroid. Dry skin is another big one. So I think we're a pretty chronically dehydrated society anyway. And there's lots of reasons for that. Thyroid might be one of them. If you're losing hair, not only head hair, but also eyebrow hair and maybe eyelash hair as well, that may be a sign that your thyroid is not running optimally. Another big one is depression. Some of the pharmacists I speak to say that you should not be medicated for depression. You should not have antidepressant medications unless someone has done a full thyroid workup for you.
And I'm just asking, that's not standard protocol now, is it?
Sometimes it's not. It really depends on who you're seeing.
Wow.
Sometimes, yeah. So that's hypo. Hyper often presents as anxiety. So that racing heartbeat, often it looks like too much metabolic activity, so muscle wasting, also weakness. There's a fatigue also inherent in being always anxious all the time. You might also have, some dry skin and some brittle hair and things like that. But a lot of people, if anxiety is new, please get your thyroid checked out, because I've seen people get diagnosed with Graves' disease, which is where the immune system starts making the thyroid hyperactive, where they just feel anxious. And they certainly shouldn't be medicated with anti-anxiety medications when the problem is their thyroid.
Oh, and this is so important that we discuss getting to the root cause and not just having a pill for an ill. And I'm not against pharmacology in any way, shape, or form. When it's needed, it's important. However, just putting a bandage approach and not getting to the root cause, which is exactly what a good naturopathic doctor tries to do, is to do the investigations, get all the knowledge and education, but then to look at how do we address that root cause instead of just treating the symptom like we just talked about with an antidepressant, and we're still, we're creating more problems because we're not dealing with what the real issue is.
Yeah.
Right. You always have to keep asking why. That's my job. People come to me because other professionals can't figure out what's happening or what's wrong. So it's my job to dig deeper. I never promise that I can find the answers right away, but I will not quit until I find that answer for somebody. And maybe sometimes it's genetic, or maybe sometimes it is stress, but a lot of times, it can be a nutrient deficiency. I've seen people who are anxious and they get the proper nutrients, the proper minerals, and they feel tons better. We've actually seen their pharmaceutical medications work better with my help.
Right,
Sweet.
there you go. And that's coming from a naturopathic doctor. And I think, you need to hear that on Let's Just Do This, because that's the way we view integrative medicine. When we think about thyroid, let's talk a little bit about autoimmune and the role that plays with the thyroid.
Yes, so speaking of the root, why does your thyroid get affected? Why does it go hyper, or why does it go hypo? So a lot of the cases of thyroid disease are actually autoimmune. What is autoimmunity? Autoimmunity is where something in your immune system goes awry, much like with allergies, and your body starts attacking your thyroid gland. So that can look like two different things, right? Hashimoto's thyroiditis is, I know it's a mouthful, bear with me, but Hashimoto's is where the autoimmune component to thyroid makes it go slower, so that's hypo. Graves' disease is where your immune system actually kicks your thyroid into overdrive. Now, the medical interventions for this can look pretty serious. For Graves' disease, people get their thyroids irradiated, or they get them removed entirely, and then they're on, supplementary thyroid hormone for the rest of their life. There are some things that we can do maybe earlier on in that game to maybe help prevent that. I would love to be able to just pluck everyone up right away so that we can treat them before they get to that stage. And I mean, if they have to have surgery, they have to have surgery, certainly, but we're going to try to make them, help them be as healthy as possible.
Yeah, prevention is so important, and I think that's where, on our Better Together mission, that big gap in care lies in that preventative piece. And we want to have truly a healthcare system, not a sick care system where we're waiting till something's broken. Now, and when it is, that yes, like you said, there may need to be surgery or pharmacology intervention, but we need to look at prevention.
You are very much a proponent of people taking care of themselves and not only advocating for themselves, but putting in the hard work to take care of themselves. We touched upon it before the break about eating well. Yeah. Is there also a component, like you said, natural stress reduction, things that they can do to reduce their stress themselves?
Yeah, Todd, I love that question. I'm a huge proponent, and I think I talked about it last time I was here, on passive care. So going and getting cared for, whether you see somebody for your massage, if you find your massage de-stressing. If my massage therapists are working on my back, that is not entirely de-stressing. I feel better afterwards.
Therapeutic.
But I'm like gripping, the table. And so that's, but maybe talk to your therapist, say, look, we're looking to de-stress today. And they'll, if you have a great relationship, you'll be able to do that.
Every massage therapist should be able to listen to their patient. I'm just going to say it from a
Throwing it out
massage
there.
therapist perspective. But you're absolutely right. And we need patients to know that they need to have their voice heard and say, today, we don't need to be on a trigger point mission. We can just kick our parasympathetics.
I do know what my rhomboids are now after discovering them.
Yes, indeed.
So that's one of the things that I will do. I will go and get cared for. I did so yesterday. I saw a particular healer, and I found it very refreshing and great. So I also get my mental game tuned up by other healthcare professionals. I going for walking. I'm a CrossFitter, and before that I was a triathlete, and I used to think intensity was key for exercise, and now I'm just a huge advocate and proponent of walking. Just walk. It's beautiful outside now, fortunately, so we need to just get out there. You've got 2 feet and a heartbeat, use them. Sometimes I'll play music, sometimes I'll put a loved one on the phone and we'll talk through something, or just to hear a loved one's voice while I'm walking. I come back and I feel great. It's a little bit of a time investment, and so that's a very active form of self-care, 100%. I'm not one to not, or that's a double negative, that's not good. But I'm one to actually go on challenges with my patients, and I said, you need to meditate, I need to meditate, we're gonna meditate together. We're gonna here's our goal, we're gonna check in, and we're gonna see how we did, just support each other gently. Yeah. It's not about perfect, don't let perfect be the enemy of good. Just start, be 1% better every day.
Yes, progress, not perfection.
Exactly.
That's something that we all strive to, but aren't necessarily good at.
No, just do it. Let's just do it.
Just do it. Let's just do this.
Absolutely. So can we talk a little bit, because I'm sure many of our viewers and listeners will want to know about medications, and perhaps they're on medication for their thyroid currently. So let's talk a little bit about, options when it comes to managing this thing called thyroid.
Right, so most patients are on T4 if they have a hypothyroid condition, or if their thyroid has been removed or irradiated. T4 is the precursor to active thyroid hormone, T3, as we talked about. That's the standard of medical care. And that's great for a lot of people, and that's fine, and it's safe, much safer than just plain old T3, because you run the risk of giving someone a heart issue if you just give them straight up T3. So I get it, T4 is safe. However, if you have a conversion issue where for a lot of reasons you're not converting T4 to T3, and we do that math, and there's all sorts of ratios that we can look at. When I look at your blood work and I have the full panel, that's something that's important for me to look at. So if you're not getting that conversion properly, you may, and I don't see a lot of people doing this unfortunately, but you may want to get a compounded T4, T3 medication. And there are pharmacists who do that with great success. And for a lot of people that works great. If the conversion part of it, if we've exhausted all our efforts to naturally help you convert T4 to T3, that compounded T4, T3 combination may actually be best for you. Again, it's kind of a last resort, but we also have that in desiccated thyroid, which is, again, not standard practice in the medical community, but we've seen a lot of patients do really well on it, actually, for whatever reason. It was used way before T4, synthetic T4 was actually invented. It is literally pulverized thyroid gland, and it is something that we use, with great effect where it is indicated. And always talk to your healthcare provider about what option is right for you.
Right. And for those listeners and viewers in the Halton area, and actually beyond, because they will actually ship compounded medications. Origins Pharmacy, Miranda Toffick, we've had on the show. I know, Dr. Webster, you've worked with Miranda, an amazing pharmacist, her and her sister Sherry, who really do look at different options for people. So, we want to have that in the resource, and we'll make sure we'll put that in the show notes as well for those of us that are interested.
They are walking the talk, 100%.
Yeah, they sure are. All right, is there anything else you would like to tell us, because we're going to have to wrap up here just very quickly. Anything else you'd want people to know about their thyroid that they can start to think about?
I want patients to think about the role of food as medicine as well, because we didn't really get into just how important food can be in the control of your thyroid or in the regulation of your thyroid.
Let's do that now. We've got a couple of minutes. Let's do that.
Okay.
Yeah.
So if you have an immune issue, if you have Hashimoto's, or if you have Graves' disease, everybody talks about gluten. It's become really cliche, but there's actually documented evidence that shows that gluten or a gluten sensitivity, even if you're not celiac, activates the immune system and makes an autoimmune thyroid condition worse. So if you have Hashimoto's or if you have Graves' disease, gluten-free is kind of the way to go. And anything that I do from a naturopathic perspective will always work better when you're eating your healthiest diet. And I don't mean that you have to stay 100% strict with your diet all the time. I just educate people. I want you to be 80% healthy and 20% fun at parties, because that's sustainable health. That's how you live your life.
Indeed. And that's really, really important. So when we talk about just some quick highlights of nutrition to support the thyroid, what are people going to put on their plates to help their thyroid?
So brightly colored fruits and veggies. You're going to need those orange veggies, sweet potatoes, squashes, carrots, because those are high in vitamin A. Antioxidants, so the green leafy stuff and the blue and red stuff, those are going to really pump up your thyroid and help your liver actually convert your thyroid hormones as well. So those are the most nutrient dense things. Get lots of omega-3 fatty acids if you can through fatty cold water fish like salmon, herring, trout, etc., and just try to get the cleanest sources possible, because there's a whole environmental aspect to thyroid too.
Oh, that's an entire show, which I think we've got to have you come back and talk about that. I mean, environmental toxins and what it's doing to our overall health is an entire topic that deserves to be investigated.
Yes.
Yes, yes. Hillary, it is such a pleasure to always have you, your passion and your knowledge on our show to share with us. If everybody wants to get a hold of you, where can they find you?
So my website is websternaturopathic.com. You can also, hit up the folks at Wallis for Wellness. They will send you my way. I always giggle because people think I am a natural path. There's actually an O, so it's naturopathic medicine, not naturopathic medicine. So Webster, like the dictionary, naturopathic.com.
Awesome. And of course, you can follow her on Facebook and Instagram and Twitter. And of course, here on Let's Just Do This and Wow New Media, it is always a great pleasure to bring education your way, integrative health education, but doing it in a real way that's tangible so that you can act on your health. So on behalf of Todd Miller, myself, the entire team here at Your TV and Wow New Media, we hope you're having a great day. And until next time, be well.